Hi, this is Dr. Bob Dannenhoffer. I am the Public Health Officer for Douglas County. It's October the 6th, and we'll do another of our Facebook Lives. This is a mask thing. This is a balaclava that has a built-in mask. It's actually very comfortable, and I kind of like it during the day. It also hides sort of my hairy chest. Anyway, again, Dr. Bob Dannenhoffer, October 6th, and we'll get started. Lots to talk about tonight, but this is a chance for you to ask questions and for us to give you the very best answers we can find. So if you have questions, put them in the chat section. Our staff here will get them to me, and we'll try and answer as many as we can tonight. So as we always do, we start at the top of the world and then move down to the local experience to tell us how things are going with COVID. Well, I've said now for about 50 times in a row, this is a very active pandemic worldwide. We're at 35 million cases, over 1 million deaths. Still very active in India, US, and Brazil, and really all of South America. It really is shocking how much disease there is in South America, except for Uruguay, but in Argentina and Chile and basically all of South America. So really a lot of disease there. We're also seeing lots of cases in France, UK, and Italy. Remember, these were 3 areas that had a lot of disease in the springtime, did a lot of lockdowns, and again, they're having lots of disease. Israel was a place we really looked carefully because it has lots of analogies to the U.S. Remember, in around August, they started opening up. By mid-September, they were having a lot of disease, and on September 13th, they went into their second lockdown. About 15 days into their second lockdown, their cases peaked and are now starting to come down, suggesting that lockdowns do work. But again, this lockdown in Israel is thought to be really very, very tough on the population. But I will tell you, in the rest of the world, it's not the same everywhere. So there are certain countries, most actually in Asia, that have done very, very well with this. So I looked at the countries of Taiwan, New Zealand, Hong Kong, not exactly countries, Singapore, Australia, and South Korea. Among them, they have 130 million people. It's a lot of people there. And in one day, they have less than 100 cases, so less than 1 case per million. Wow. That's a lot. That's a lot of disease control, not a lot of cases. In Japan, with about 150 million people, about 400 cases a day. So certainly Asia has done well on this, and there'll be a question at some point why Asia has done so much better on this than the rest of the world. And if we have time tonight, we might talk about that. We look at Canada with about 1/6 as many people as the US, 300-400 cases a day. So there are clearly in this world countries that are doing very well with this and countries doing less well. Certainly India and Brazil and the US have far and away the most cases and far and away the most deaths. In the US, we're at 7.6 million cases, 214,000 deaths. Just on last Friday, there were 50,000 cases. So we hadn't been up to 50 in a long time. There were 50,000 cases. And there were 21 states that had more than 1,000 cases in a day. So at more than 1,000 cases a day, there are so many balls in the air, it is almost impossible to figure out what's going on. And so that's very worrisome. Very active in California, Texas, and Florida, and New York and Virginia, which had a low rate of disease, now starting to come up. In Oregon, we're at about 35,000 cases and 572 deaths. Very active in Lane, Marion, and Benton counties. We think Lane and Benton because of University of Oregon and OSU, but also very prominent in Marion County, Malheur County. We're seeing some big prison outbreaks. There are 5 prisons in Oregon that just have COVID running rampant. In Douglas County, we're at 256 cases, maybe more since yesterday, and 4 deaths. We had 22 cases in the last 7 days. So one of the questions that's come up on Facebook a bunch is, can you tell us how many cases we've had in terms of the school metrics? So the way I do it is I look at the number on Tuesday today, look at the number Tuesday last week, subtract that number, and you'll get an idea of what it is week to week. The state, when they look at our numbers for school reopening, use what's called the morbidity and mortality week, which starts at 12:01 a.m. on Sunday and goes to midnight on Saturday. So it's Sunday through Saturday. And the way they can count cases is when they get them, and it's a little confusing because sometimes we know about the case before the state. So, for example, if there's a person at Mercy who tests positive or at Nova that tests positive, we get that report. They call us right away when they get the report, so we know about it before the state does. And then there are other times when there's reports coming in from a laboratory that go from the laboratory to the state to us, so they know about it before we do. So the numbers on a day-to-day basis may be +1 or -1 in comparison to what you see, and that's where the difference is. But overall, the numbers in the end turn out to be exactly the same. So in Douglas County, we're still working through 9 outbreaks. It's a lot of outbreaks, but none are very active today. So that's a good sign that that some of these outbreaks, which had been very active a few weeks ago, are now quieting down. We're seeing more sporadic cases, more onesie, twosies. And so that's why the numbers in isolation have come down a little bit in the last week. Okay. Okay, so Janetta asks, what is your opinion in schools with poor ventilation systems based on the announcement that COVID is airborne? Yes, the CDC did come out today with the thing that, yes, it may be airborne. I mean, that's like, duh. Of course, we kind of thought that, right? Because there were times where people spread it to many people at once. So this choir practice where they spread it to 50 other people, or these ships where they spread it to a lot of people, or churches where they spread it to hundreds of people, that couldn't, unless this person was walking around spitting in everybody's face, this really couldn't be just droplets. So I think all of us have assumed that at least there's some carriage which is airborne. And so, yes, not surprisingly, it's airborne. So when it's airborne, that means that stuff can get in the air and stay in the air for a while. So when you think about it, when you talk, sometimes people make spit that you can actually see. Sometimes there are smaller parts. And then presumably there are these tiny little particles that go out that stay in the air for a long period of time. So what I tell people is if you throw a rock at them, it stays in the air for a little bit and gets to the ground. If you throw sand at them, it goes a little further before it comes to the ground. But if you throw the dust that goes along with sand, which is just tiny particles of sand, it stays in the air for longer. And these particles are even smaller than that, and they can stay in the air for a while. So to deal with airborne transmission, distance certainly makes it, distance between people clearly makes a difference. But in addition, good ventilation. So opening the windows, being outdoors, or improving your ventilation systems. So I've worked with a bunch of the schools about ventilation, and what they can do is they can open windows, open doors. If they do have older ventilation systems, they can increase the air changes per hour, and they can increase their filtration. So I've probably been good for the HVAC community because I've suggested that these people really have their HVAC systems looked at to increase the amount of airflow. Now, airflow can be measured in lots of ways, but I think the best way is air changes per hour. So there's air in this room, a certain volume of air in this room. There's a system in here which circulates the air. How many times per hour is the air moved about? Hospital operating rooms, which have the best ventilation around, about 15 changes per hour. Actually, airplanes have really good ventilation inside the airplanes while they're flying at about 15 per hour. The well-ventilated place, 3 to 5. But there are places that have very, very, very little air exchange, and that would be a danger. So we are encouraging schools to look at their ventilation and to improve their ventilation as much as possible. So Christy says, do I think kids going back to school is a good idea? Well, I think kids going back to school, absent disease, is a great idea. I mean, obviously before COVID, I was all in favor of kids going to school. The question is, what is the balance of kids going to school at the time where there is COVID? And anytime there's any COVID around, there is going to be a risk of being to school. But there's a risk of other things too. There's a risk of a school bus getting into an accident, and that's why we take incredible measures to make school buses safe. But still, we send our kids to school on a school bus, even though there is a risk of a school bus accident and a death from that. There's other diseases going around. There's meningitis and other things that go around, and we don't close school because of that. And school's got some very positive things. Kids go to school to learn, which is certainly great. Kids go to school to get meals. I mean, there are a lot of kids who don't have enough meals. I was with a family today, and we were talking about this kid had headaches, and one of the things that happens is when kids don't eat regularly, there are some kids who have these childhood migraines, these just miserable headaches. And so I asked, he said, well, we've got a lot of kids, and sometimes at the end of the month we don't have enough food. Well, when kids are at school, they do eat at school, and for some kids that's the only time they get a good meal. And then there are kids at school who are protected from maybe abuse or something at home. So there are lots of benefits from schools, and then there's the risk of COVID. And it's up to the people who make these decisions, the governor, ODE, and the school boards, to balance the benefits of school, the great benefits of learning, the great benefits of socialization, the benefits of adequate lunch, the benefits of protection from abuse, against the risk, which is, are we going to get COVID? And you have to balance those, and I will tell you, finding the right balance is very hard. There are some said you shouldn't open schools until there is no disease in the state for a month. That's the strongest I've heard. Well, if we wait until there's no disease in the state for a month, we will not open schools for 2 or 3 years. Other people said, I don't care what the level of disease is. Kids don't get that sick, just send them to school anytime. And so we have two very, very, very diametrically opposed opinions. And how do we find something in between? So I got to be part of the group to look at that. So we looked at other countries that had opened schools successfully with a lot of spread of disease. They tended to do it when they had small cohorts and when the background level of disease in the community was low. We looked at some places that weren't quite successful, like Israel. They opened schools when there was still a fair amount of disease in the community and didn't take a lot of precautions, and they've had a lot of issues. And so we tried to find a balance for this, and the balance that was suggested was if the rate of disease is very low and you have small cohorts and you start with younger kids, it's probably going to be safe, and that's how we started. It gets a little dicier when you get to higher levels of disease in high school, because in high school the kids move around a bit more, and so it's a very tough decision. And I go ahead and talk to school boards and give them an idea of what's going on. But again, the decision is theirs. I'd like to say that public health is like the weatherman. The weatherman collects the data on rainfall and temperature and whatever else. They can look at what's happened in other countries, and then they make a prediction about what's going to happen. Like it's rained for the last 4 days, it looks like it's going to rain for the next 4 days. But then it's up to you to make the decision if you still want to have that outdoor picnic or you want to have your outdoor baseball game. It's your decision. I mean, the weatherman doesn't ever get to make the decision about whether you should have your baseball game or your picnic. I mean, it's the ball club that decides not to do it. It's the people who decide not to have the picnic. When they close school because of snow, it's not the weatherman who says you should close school. It's the school board who makes that decision. So again, public health is like the weatherman. I think what I would say now is the weather is not nearly as good as it was in August when we had only 3 cases in 1 week and a very low positivity rate. Positivity rate is still acceptable. Our rate is slightly higher, but still one of the lowest in the state. So what I would say is our rate is higher than it was before. There's a lot of disease in counties around us, Jackson and Lane around us. So I think we need to be very careful. But the school board, it's your decision. Again, if people don't like that, the way to do that is the next time the school boards come up, vote for people who will vote the way you want. But the problem is that we're so opposed. I mean, it's not like people are saying, well, maybe it's not 10 per 100,000. Maybe it should be 11.6. Because I saw this study in a place where they opened at 11.6 and they did well. No, people are so diametrically opposed. Don't ever open schools if there's any risk. And then other people say, I don't care what the risk is, open schools. And we as a country really have to get to the point where we can have some logical discussion. So Janetta says, why are there not clear guidelines in the masks teachers use? So there are clear guidelines. I mean, the clear guidelines are the facial covering guidelines that the governor put out. So someone says, I'm very concerned about a local trick or treat. Would you talk about if this is a good idea? Well, let me talk about overall what's good ideas and bad ideas. I went to a restaurant the other night. I sat in the corner all by myself. There were tables of 15 or 20 people on top of each other for hours, no masks, talking and yelling and telling stories and whatever else. That's really bad. Okay, that was indoors. That was a lot of people close together for a long time. Please, please, please don't do that. Halloween parties where you have everybody dressed up in a mask, close together indoors for a long period of time, clearly not a safe activity. However, trick-or-treating at a distance, outdoors, momentary contact, if you maintain 6 feet and wear a mask, really, in the whole scheme of things, relatively safe in comparison to any of those indoor parties that I saw. And if we think it's really important as a country for our kids to go back to school, that was what I would say. I mean, I think if you maintain distance, I think if you do it outdoors, I think if you use masks, trick-or-treating could be one of those moderate risk, those not zero risk, but moderate risk activities. So Marlene says, what treatment is given to those who have tested positive? Well, we're going to talk a little later about what the president got, but most people who have COVID get no treatment. So remember, about 20 to 40% of the people who have the disease are asymptomatic. They're asymptomatic, so not surprisingly, they don't get much treatment. There's another 40% or so who have mild disease, cough, fever, whatever. They usually just get over-the-counter kind of things like aspirin or Tylenol or ibuprofen. And then there's 20% or so that are sick enough to be in the hospital. And when they're in the hospital, they may get a variety of treatments, which we'll talk about later when we talk about the president. But again, most people about 80% of people get no specific treatment at all. So Veronica says, how many cases have there been in schools here? There has been a single case in a first grader in Sutherland. Single case, no secondary confirmed cases that we know of in the school. We've tested all people in the class and the teachers, anybody who want to get tested. We did it last Tuesday and again today. And so far we have no positives, but we'll see. So a local physician put out another letter saying if those he has treated with COVID, that they're being shamed for catching the disease, and that most had no idea where they got it, as they wear masks and social distance. Is that accurate? I don't know about those. I mean, I don't know about this letter. I haven't seen it. I will tell you, almost everybody we've seen has real breaches in mask use. Right? Most of these people have gotten it in family gatherings. So they went to a family dinner with 8 or 10 other people or whatever. And the question is, did you wear a mask all the time? Well, no, we were at dinner and I was with the family, and that's where they got it. Or it was at work where it was very clear that there was a breakdown in protocol. Again, when we look at work, it's not usually you get it from patients to doctor or doctor to patient, or a person getting their hairstyle to the stylist, or the other way around. It tends to be between workers. And again, that's not surprising to me. I mean, I'm working at the clinic today. I went to the clinic, I had my mask on the whole way, but it wouldn't be shocking that if I had lunch at the clinic, I might have lunch in the clinic in the break room. I might be 6 feet apart, but that would be higher risk than my clinic work when I'm wearing a mask. So Kat says, would the old-fashioned ceiling and box fans help air circulation? It matters how they are used. If it just circulates the air in the room, probably not as much. But if it's in the window and brings in fresh air or sucks out fresh air, even better, or sucks out air into the fresh and then other air comes in, those can help. Trunk or treat. Oh, people said trunk or treat. Well, so, I hadn't heard about trunk or treat before. Again, I don't know the details that people are going to use, but outdoors, 6 feet distancing, masks, pretty safe. So Stacy said, did I leave the restaurant with the large number of people? No, I mean, I was at least 20 feet away from anybody else, so I think I was very safe. It except when I was eating, I wore a mask. And this is a restaurant owned by people that I know and like. And so their restaurant should make it. But it's that behavior of all those people getting together that's really dangerous. Let's put things on a risk stratification, right? So that if you say, well, driving in my car at the speed limit, totally sober and well rested, is relatively low risk. It gets higher and higher as I drive faster, as I drive sleepier, as I drive after drinking, as I drive more recklessly, as I pass and whatever, and there's a continuum of risk. Again, 15 people for an hour sitting within 2 feet of each other, laughing and whatever, is incredibly risky, because the chance that one of those 15 is infected is not insignificant. And if one of them is infected and they're in the infectious phase, they can spread it to so many others. So no, I didn't leave the restaurant. I think leaving the restaurant wouldn't have certainly reduced their risk. And since I was 20 feet away, I'm not sure it would have reduced my risk at all. But again, it's that kind of behavior which is worrisome. So Veronica says, can low oxygen levels be the only sign of COVID? I don't think in any of our patients that was the case. Now, what is striking about the low oxygen levels here is there are many people who don't know they have the low oxygen levels. Unlike with other diseases, where when your oxygen level starts getting under 90, these people are really short of breath and they're really huffing to breathe. One of the things that was striking in some of the early reports is that people would be seen in the hospital, they'd have an oxygen saturation of 60, 92 and above being normal, of 60, and they didn't look particularly short of breath. They were on their phone talking to neighbors or whatever. And the guy said, well, this can't be right. You can't have an oxygen saturation of 60 and look that relatively comfortable. So there may be people who have low oxygen levels we don't know about, but I don't think low oxygen levels is the only sign of COVID. I don't think we have seen that. Doesn't mean it couldn't happen, but I don't think we've seen that in any of our patients. So Heather says, is fever still a good indicator to send a child home from school? Well, I think during this time of COVID, we don't want anybody sick at school. So I think a lot of things in the past that we might tolerate, a little bit of cough, a little bit of runny nose, a little bit of fever, I think we're not going to tolerate this year. And I think that's logical, right? Because your kid may miss 2 or 3 weeks of school with this fever and the colds and whatever else. That missing 2 or 3 weeks of school, if it saves everybody else from being in school, is probably a worthwhile thing. So I think this year has got to be a different year, right? It's going to be a year where kids are going to miss more school because they're going to stay home when they're sick. It's going to be a year where classes may get quarantined. I think we just have to assume that it's going to be different. But in some ways could be better. I mean, there are other places in the world that go to school year-round and have little breaks through the year. I mean, the U.S., there are a couple other countries that still do this long year with not very much vacation and then a long summer vacation that harkens back to the days when the kids worked on the farm. I mean, you needed kids starting in about mid-May through August to pick the crops and do the things in the field. And so that we've carried on with that. Okay, well, a couple of things I want to talk about. One is I wanted to talk about the president. I mean, how can you not do that? And what I wanted to talk about, though, was not about the politics associated with this, of which there's plenty. I wanted to talk about the medical aspects of this. So again, let's think about this disease. So this disease typically has an incubation period between 2 and 14 days, although almost everybody we've seen gets sick on the 4th, 5th, or 6th day after they were exposed. The first signs of this disease are kind of vague. Some people feel fatigued. Some people have a little bit of runny nose. Some people have a little bit of sore throat, but not much more than that. As the days go on, they may start getting some fever. They may start getting some cough and runny nose. But most people do not go into the hospital or have low oxygen levels until the 7th or 8th day of illness, which is usually 12 days after exposure. So the president's course is, if indeed he, like the many other people who were there, so like 20 people in the White House who have the disease, and it's likely they were exposed sometime on Saturday when they did the Supreme Court thing in the Rose Garden, and they also did debate prep. So it probably Saturday was the day that the president was infected. So Saturday to Sunday, Monday, Tuesday, Wednesday, Thursday, when he had his first positive test. So 5 days, that would be exactly right. The thing that's very unusual about his case is usually in the first few days, you do not have high fever, which he apparently had, and you don't get low oxygen levels. So that he would have low oxygen levels on the second day of illness is distinctly unusual. In fact, we went back. We couldn't find another patient in our series, which is not infinite, but is about 40 people, where we could find that. The other thing is, that's very unusual, is to be admitted to the hospital in that first week. Most of our admissions were 7th or 8th day after symptoms started. So 7th or 8th day they did it. And that's why you've heard a few people say he's not out of the woods yet, because he's not 7 or 8 days after the diagnosis. So I think we still have to be cautious about what's going on. So what did the president get? So it appears the president got, for a little bit at least, got some oxygen. Oxygen, way old thing. Helps people have low oxygen levels, nothing special there. He got, on the first day, this thing called Regeneron's cocktail, which is 2 monoclonal antibodies. And this is a thing that's been studied. There's only a few hundred people published. It showed that when people got it, they had somewhat lower viral loads, and they were a little less likely to wind up in the emergency room than people who didn't get it. But, we were hoping that this would be great, that this would be a home run. Even the company says, well, this isn't a home run, and I don't think so. I think this is maybe a clean single to left. He got zinc. I don't know what zinc does, but zinc doesn't seem to hurt you at all. There's some people who really swear by zinc for upper respiratory infections. He got Pepsid. Pepsid is an antacid. And you'll remember back in June and July, we had talked about some interest in Pepsid because it was recognized in China that people who took Pepsid did better than if they took more expensive, more complicated proton pump inhibitors. And so he got Pepsid. The data in this country is still very weak. I can't find very much about Pepsid, but it doesn't seem to hurt. I mean, a lot of us take it for heartburn or whatever, so he got that. He got this next day when he got sicker and had this and went to Walter Reed, he got remdesivir. So remdesivir is an antiviral drug, sort of like you'd use acyclovir for shingles, or you'd use acyclovir for chickenpox, or for cold sore, or like you'd use HIV drugs for the HIV virus. This is an antiviral drug that was developed to fight Ebola. It didn't work very well with Ebola, but it works a little bit against this, and he got that. The other thing that he got then was Decadron. And Decadron is a steroid, old steroid. It's been around since the 50s. And it's been shown in people with severe disease to make them better. So it's a little concerning that 2 days into this, they thought he was severe enough to get Decadron. But basically, all of the things you can get for this, he's already gotten. So we're hoping we'll see what happens. So Bethesda's a great hospital. That's where I have my first duty station, and I'm sure he's getting great care. So Crystal says, long question here, my son was running a fever, had a stuffy nose and cough. He's fever-free 24 hours now. If he is still coughing and has a runny nose next week, should I keep him home? Yes. His rapid COVID test was negative. Great. So there are a lot of people now we're starting to see as fall comes around, a lot of people with disease. So in that first grade class, there were a lot of kids with cough and snotty noses and whatever. None had COVID. Again, most of the people who have cough and runny nose now are not going to have COVID. They're going to have a cough and runny nose, rhinovirus or something else, but some will. And since it's not easy to distinguish who they are, people who have symptoms should stay home. And again, that's going to cause, especially if you're in kindergarten or first grade. So most kindergartners get 7 illnesses during kindergarten. I think, it seems like your kid goes to kindergarten, gets sick, it's just getting better, gets sick again, just gets better, gets sick again. So kids are going to have lots of illness and they may miss a week or so when they're sick. I think that's just the price we have to pay for schools being open in the time of COVID. Yeah, so Shelley says, could a COVID test using a cotton swab inserted 1.5 inches into the nose be as sensitive as the plastic one inserted 5 inches? So there's 3 major kinds of tests. The first is the CDC test for COVID. It uses a 3-chain polymerase chain reaction. It takes 4 to 6 hours, has to be done in a very specialized lab, and it is the gold standard. To get that, you use a deep nasopharyngeal swab, which is the one that goes in 5 inches. So yes, the one that goes in 5 inches that you send away to the lab for 2 or 3 days is the most sensitive and the most specific test. It's also the most expensive and the slowest and the most uncomfortable. The second is called a rapid nucleic acid amplification test, and that could be the BioFire like they have at Lower Umpqua Hospital. It could be the Cepheid that they have at a lot of different places, or it could be the Abbott ID Now that they were using at the White House. These are less sensitive, but they only go in the front of your nose, and they're quicker, and then you get the result in an hour or 2, depending on which test. And so those are the mid-range. The simplest tests are the antigen tests, which are now done in the nose, but eventually may be done with saliva. They only take 15 minutes, and they're the least sensitive and the least specific. So you have 3 tests. You have the gold standard, expensive, difficult, and slow. And then you have the antigen test, which is quick, cheap. They're only $5. Quick, cheap, less sensitive. And so there's again a continuum along the way. And so if you have somebody who's symptomatic, kid comes in with a runny nose and sore throat, you're not wanting to do that deep swab, send it away for days and whatever. That's the perfect candidate for using one of the less accurate but quicker tests. If you're planning to do open heart surgery and you want to know if you really have it or not, you definitely should do the deep nasal swab and the PCR. And then there's different ways along the way. So it is complicated. Now, the varying sensitivities of this are not that different. So while on the same specimen that you know has virus in it, the deep PCR test is nearly 100% sensitive and 100% specific. And when you get to the other ones, they're about in the 90s. So that's what you get. All right. So how can a vaccine work when people are getting COVID a second time? That is a great question, and we don't know the answer to that. Now, we think that the people who are getting COVID second time are rare phenomena, right? Only 2 well-documented cases, so a rare phenomena. So I don't think that this is going to be I don't know how common it is. If it's very common, that's going to be not looking good for the vaccine. On the other hand, if it is rare, only 2 reported cases means it's pretty rare. The vaccine may help. And again, nobody is thinking the vaccine is going to be 100% effective like the smallpox vaccine or 100% effective like the measles vaccine. You know, if it's 50% effective, we'll be pretty happy. And if it is, that would really help. Now, will that get rid of it? No. You're still going to have to do all of these other things. Yeah, so Tabitha says, will we see the tests that the governor discussed today, and how will they be deployed? So unfortunately, I've been in the middle of a lot of these things, but I'm right in the middle of this. And the new test is a thing called the Binax Now. It is a test that's, when you put it here, it's about this big, and you do a swab from the front part of the nose. You put it in this thing, put a little juice on it, and in 15 minutes you get an answer, and it reads out with 1 line for the control and then a second line if it's positive, sort of like a pregnancy test, and so it's pretty good. Now, it's pretty accurate. I'm not sure how accurate it is. Now, the country bought $750 million worth of these, and they tested on 100 people. 100 people. And so we're not exactly sure what the sensitivity and specificity on this one is. It was tested on no children. So we don't really know how it's going to work in children, but the thought is it's going to work well. Anyway, so they should be coming out soon. The deployment structure in Douglas County is that they should be as easy to get a Buy Next Now test as it is to buy a lottery ticket. And so they should be lots of different places. We're trying to get them out to as many clinics as we can so that people can get this test. Now, it does need to be done in a clinic that has got a CLIA waiver. There are a bunch of those in town. And it has to be done in a place where there's a provider there. So this is not something you can do in the grocery store, but it is something you do in every clinic. And our goal would be to get this out to as many clinics as possible. So we'll see how it works. I think it's going to be great. So is it true that remdesivir is $3,000 a pop? Oh, yeah. It's a little more than that. So, yeah, it's about $3,000 a course. It's a lot of money. Although, it's not as much money as other things. I mean, there's lots of other things that are very expensive. If it does save one day of hospitalization, it appears to, it's a good bargain because a hospital day clearly costs more than $3,000. So Jenny says, our numbers are going up and Myrtle Creek schools are still open. What would make them go back to virtual? So there's a complicated formula, but if our county rate of cases was over 30 per 100,000 per week, or our positivity rate was above 5%, then they would need to prepare to go to virtual. And if it did that for a second week, then they would need to go to virtual. We've never been above 30 and we've never been above 5%. It certainly could happen, but we've never been there before. All right. Somebody wanted me to talk about long haulers. And long hauler stuff is really interesting. So these are people who've had the disease and continue to have symptoms weeks or months later. So there's three things I'd have you look at. One is an article in Nature. We'll see if we can get that up tomorrow. An article in Nature that's written in layman language that tells about these people having long-term symptoms. So a good number of people in the long term have this sort of mental fog. A lot of people have fatigue, chest pain, shortness of breath, difficulty concentrating, difficulty exercising, hair loss, sometimes a loss of sense of smell or taste that goes on for a long time. There's some mental health things, depression and whatever, that are associated with being sick for a long time. The second thing is an article in the Journal of the American Medical Association, more medical thing, that looked at this. Again, they looked at people who are about 60 days out. 85% still had one or more symptoms, and there's a list of all the different symptoms we have. We'll send you a link to that. And then the third is when we talked to the people who were our first 20 cases. Most of them were still not feeling back to normal. Many of them had one or more symptoms, and they were just those symptoms: shortness of breath, dyspnea, feeling like they were in a fog. Some people still had some diarrhea. None still had taste loss. So that's a good thing. Tasting food is a good thing. And so long symptoms seem to be the rule rather than the exception. The symptoms are sort of a wide list of symptoms, not surprisingly related to the initial symptoms that went on, and that treatment didn't seem to make a big difference. Now, we didn't have that many people who got specific treatment, but even people who were moderately ill, so not ill enough to be in the hospital, still didn't feel right for a long time. That's why it's really different from the flu. A lot of people have the flu. 2 weeks later, you're 100%. Very few people are 100%, even at 2 months. The other thing is this myocarditis, which is this inflammation of the heart that you get, and we're still trying to figure this out. The NCAA is very concerned because a lot of the NCAA athletes have had COVID. Among football players, certainly blacks are overrepresented. Many are from the South, areas where there's been a lot of disease, and groups where there's been a lot of disease. So a tremendous number of level 1 or division 1 college football players have had COVID. And about a third of them have abnormal heart MRIs. Not sure what to make of this. Is this going to cause troubles or not cause troubles? But it's a real worry. I mean, if you have heart inflammation is not all that common. So it's not one of those things you say, oh, we see it all the time. Heart inflammation is really quite uncommon. In fact, I can't remember the last time I saw a kid who had it. So if we're now going to have a bunch of young athletes and young people with heart inflammation, we're not sure what that's going to mean. Maybe it's just a little bit of heart inflammation that will go away in 3 or 6 months. That would be then unfortunate, but not in the end. But if you had long-term heart inflammation can cause a weakening of the muscle. Weakening of the muscle could lead to congestive heart failure at an early age, something we almost never see, or could lead to troubles with the conducting pathways. So your heart has this really complicated little electrical system that makes it beat. So I mean, think of my heart beating millions of times in a year, and then over 64 years, it's beat a lot of times and has never missed a beat. And so that's pretty darn amazing. And what we worry about is that there'll be inflammation along the conducting pathways, which will cause arrhythmias, which can cause all kinds of issues. And so the myocarditis actually may turn out to be one of the most serious long-term consequences. The other one we worry about is that now we're a little bit further out from the early cases in Italy, and they've done sequential imaging of people's chests. Well, looking good. I will tell you that many of these really nasty looking chest CTs 3 months later is still really nasty looking. 6 months later, still nasty looking. So, what you'll see with pneumonia, sort of typical, you come in, you got this terrible looking pneumonia, and the kid's in the hospital, oh my goodness gracious, I hope that gets better. And you treat them with antibiotics and whatever, 2 or 3 weeks they're better, and then you have them come back a month later for a chest x-ray. 95% of the time they come back in a month and their chest is perfectly normal. You couldn't even tell that they ever had pneumonia. Unfortunately, with this one, 6 months later, many of those people still have really, really ugly looking chest x-rays and chest CTs, and that's a big concern. Was that dispatch? I'm on call for public health. Sometimes it is. All right. If you've got more questions, do them. We'll be getting going soon here. A couple more things that I did want to talk about. One was was about imaging. And so imaging of the chest did 2 ways. One is a chest x-ray, which is a single beam of x-rays. The second is a chest CT, which moves around your chest and gives you a 3-dimensional thing. They had not mentioned which test the president got, although presumably he got both. And then the third way to do it is by ultrasound, which is like when you have a baby, they do it. You can also do it in the lungs to look for changes. And the changes with COVID show up a little bit on chest x-ray. They're not that specific. The findings on chest CT are much more specific, and then you can have issues with ultrasound. So Kat says, tells us to talk about herd immunity. So herd immunity means that enough people in a community have immunity from a disease so they won't get it anymore. So let's take measles before 1960. So what happened with measles before 1960 is that everybody would wind up getting measles sometime in their life. There was the incredibly rare person who was born before 1956 who did get measles, less than 1%. And so pretty much everybody got measles. And you typically got measles when you were in 2nd or 3rd grade. I was in 3rd grade when you would get the measles. And you'd get the measles. A lot of people got sick. About 1 in 1,000 died. And then you would then have lifelong immunity. And so the reason then you wouldn't, when measles now came into community, a lot of the kids who were less than 8 would get it. But you'd rarely see an adult with it. And you'd almost never get an adult who was really sick with it because they all had it when they were young. And so in a time where you have no treatment, in a time when you have no vaccine, herd immunity is kind of what you got to do. And so that's it. So with COVID, could we work on a herd immunity thing? And I think we could. So this is what it would look like if we did herd immunity. So if we did herd immunity, we just said, let this disease pass. This disease would presumably infect 60 or 70% of the people in Douglas County. probably over the space of 3 or 4 years, 60 or 70,000 people in Douglas County would get the disease. It's a lot of people. We know that with our hospitalizations, that among older people, about half of older people get hospitalized. Since we've got about 30,000 people who are over 60, that means we'd have 15,000 hospitalizations. We'd have a lot of deaths. There'd be a lot of worry about people getting in nursing homes or whatever, but we would then get to a point where enough people in the area were immune where it couldn't spread. But that assumes that the immunity to this is a long-lasting immunity. We don't know that answer. And those deaths would be lost if we now later find a great vaccine. Those deaths would later be lost if we found a great therapeutic. And so the idea on this one is to hold off the deaths as long as you can, hoping for a vaccine, for an effective therapeutic, or something else that's just going to bring the disease down. So herd immunity is a strategy. I just think it's a terrible strategy. I think the strategy that Oregon has followed is probably the best strategy. We've tried to keep the cases low. We try to not overwhelm the hospitals, and I think we've done it. So Donna says, don't lots of viruses cause heart problems later in life? Many viruses do. So I know influenza B virus especially, can cause this. In fact, I have one kid who got influenza B and got so bad that he wound up with this myocarditis and actually wound up with a heart transplant. And so yes, it can happen, but the rate of this happening from influenza B is infinitesimal. Right? It's 1 a year in Oregon, 1 a year. The rate of the myocarditis following this is anywhere between 1 in 5 and 1 in 3. So a totally different order of magnitude of the likelihood. And unfortunately, this kid's heart problem was really pretty awful. He got myocarditis and he needed a heart transplant. So it's a worry. So yes, there are lots of viruses that can cause this, but they cause it at a much lower rate than this. So if this happened in 1 in 1,000 or 1 in 5,000 people with it, it would be kind of a thing of medical interest. But at 1 in 4 or so, wow. So Teresa says, what should you do if you were notified that you were close contact of a positive case? So if you were the close contact of a positive case, and close contact usually means less than 6 feet, more than 15 minutes. And so I try really hard in my life to have no contacts other than my wife. But if I was a close contact of a case, let's say I went on a car ride with somebody to the coast and neither of us were wearing masks, we would obviously have been less than 6 feet for more than 15 minutes. We've been in contacts. And that's why when we were going over the coast to do the drive-through clinics over there, Commissioner Freeman went every week and I went every week, but we never rode together because I didn't want to potentially infect him and he didn't potentially want to infect me. So I went with my wife, and when he went over there, he went by himself or with somebody else, but we were not going to infect each other. So if I were a close contact with a positive case, you should quarantine for 2 weeks. And this is one of the most disturbing things that I'm seeing in Washington. There are a lot of people who were close contacts of somebody who was infected and they're not quarantining. Most people will be fine. So if you are a close contact of a case, most people will not get it. That's the good news. The problem is some people will get it, and those who get it can now spread it to others. And so if there was a way to predict as soon as the contact whether you're going to get it or not, that would be great. It's really hard to predict. So if you're a close contact, positive case, stay home. Okay, it looks like that's tonight. We've got to get going here. I have a call from dispatch. Again, this is Dr. Bob Dannenhoffer, Public Health Officer from Douglas County. Thank you.